Thank you all so much for coming and sharing your Sunday evening with us. We're very excited to have everyone here. Very, very excited to see this film, and it's just a pleasure to have Chris and Patrick and Jessica here. We'll be speaking with them more after the film. So I'm here to welcome you to the opening event of our annual Rare Disease Week. I'm Vicki Seifert-Margolis. I'm the CEO of a digital health company called Respond Health, but more importantly, I'm the chair of the board of directors for the Every Life Foundation for Rare Diseases. The rare disease space, as we know, is complex and mostly uncharted, and for those reasons, many rare disease foundations have been established, each doing important work representing various dimensions of the need for our patients and their families. And we at Every Life are proud to be a partner and collaborator with these organizations to advance the very important causes of the rare disease community. I am very honored and humbled to be among you, particularly this year, as the Every Life Foundation for Rare Diseases celebrates its 15th anniversary. I think we should give that a round of applause. Was that a dog even cheering? 15th anniversary as a unified organization that's stronger than ever. We distinguish ourselves as catalysts for change, exploring and defining evidence-based approaches to empower the rare disease community, as we all advocate for science-driven legislation and policies to advance equitable development of and access to life-saving diagnoses, treatments, and cures. We create programs like our Rare Disease Week to help empower patient advocates and to move decision makers towards change. And I want to take a moment to thank every one of the Every Life staff, board members, supporters, and most importantly, our Every Life community for the incredible work and accomplishments that we've achieved over the last 15 years. I love the dog. From the Orphan Drug Act to studies on the diagnostic odyssey and burden of rare disease, newborn screening, and our critical participation in bringing cutting-edge science from the bench to our patients, we have achieved so much, but there is still much unfinished work to do. As we embark on the next 15 years, we at Every Life hope to widen our community tent and embrace more patients, more families to participate in whatever capacity works for them, and to grow Every Life in its mission to further catalyze moving cutting-edge science to treatments for our patients in a fair and equitable manner. And I cannot think of a better way to celebrate 15 years than to kick off Rare Disease Week with a film that reaches new heights. Chris Bombardier, his wife Jessica, and Patrick James Lynch exemplify the power of the individual patient to catalyze change and bring communities together through action. As you will see, Chris's 7-peak quest was long, with complications and hurdles along the way. It was not a straight path. It was quite literally a constant uphill climb. The flag he waved across continents helped more people understand the magnitude of people affected by diseases that are rare and the wide disparities of care among them. Chris, thank you for letting us witness your journey tonight as we watch Bombardier Blood together. A journey that began with challenges and disappointments over the things that hemophilia prevented you from doing, to redefining yourself, gaining a sense of purpose, and showing extraordinary courage, endurance, and resilience, and for building a powerful voice and community at Save One Life. As you know, our rare disease mascot is the zebra. Zebras may be the mascot for rare, but when they band together, they are heard. Thank you. And now, before we move on to the documentary, I'd like to introduce Allison Clifford, the Director of Therapeutic Policy and Advocacy for Takeda Pharmaceuticals, our sponsor for tonight's event. In her 25 years working in the biotech pharmaceutical industry, she has worked with national patient advocacy organizations and is most recently supporting hematology and bleeding disorder programs at Takeda. Allison, welcome.
Hello, thank you for that welcome. I'm delighted to be here tonight. I want to personally and obviously on behalf of Takeda thank, well, first, before I start, I'm here with two of my colleagues who I think some people in this room know. So Rodney Dixon and Andrew Hebert. And Rodney leads our therapeutic policy and advocacy team. So thanks to EveryLife for the opportunity to be here tonight and for inviting us to participate in this event. Thanks to all of you for traveling to DC. Some of you may live here, but I don't think everyone does. So thank you for being here and participating in Rare Disease Week. I'm here to say a few words about the importance of our partnership with the EveryLife Foundation, our partnership with the rare disease community, and I'm certainly here to introduce and kick off the documentary, but I first wanted to also congratulate the EveryLife Foundation on your 15-year anniversary. I know we did a round of applause, but we could maybe do it again. It's an honor to acknowledge and recognize all the incredible work that your foundation does and the leading role in particularly that you play this week in Rare Disease Week. So on behalf of Takeda, just I'm going to do 3 highlights, and then I'm going to get to the kickoff. So first, we're privileged to partner with the EveryLife Foundation and others to learn and understand the needs and concerns of the rare disease community so that we can do our part and partner to help ensure accurate and timely diagnosis, remove or break down access barriers, and improve standards of care. Secondly, we're dedicated to partnering with the EveryLife Foundation to bridge gaps in care in order to achieve optimal outcomes for patients living with rare diseases, including those in marginalized and underserved communities. And then thirdly, or lastly, Takeda works to bring our values and PTRB decision-making process, which stands for patients, trust, reputation, and business, and putting P first, always putting patients first. And we do that and we have this decision-making process to bring those values to life in meaningful and tangible ways for patients. And this extends beyond bringing potential new treatments and cures. It's our commitment to being a thoughtful and responsible contributor for essential change across the US healthcare system. So finally, what we're here for tonight. It was mentioned that I've been involved with bleeding disorders, as has Rodney, and Andrew maybe a little more recently, but it is such an honor. We have known Chris Bombardier and Patrick James Lynch and Jess through the film for 20 years and have seen the incredible work that both of these individuals have done. It's just outstanding, the tremendous impact that they've had on the bleeding disorders community. So I could not be more excited to do the kickoff to Bombardier Blood and wish all of you a wonderful Rare Disease Week. Thank you.
I'm so excited. A little nervous, actually. This is the second time I've seen the film, and it's great each time. So, we are so privileged to have this group of people here with us. Allison Clifford. It's not, where is she? Oh, I thought you were coming up. No. All right, well, Allison's down there. Chris, who needs no introduction, I don't know what else I can say. You're amazing. Jessica Bombardier is with us. She's been involved in several aspects of the bleeding and disorder community, from attending events to running programs called Backpacks and Bleeders. Your dedication to rare disease has continued, and you are one hell of a wife. And a scientist. And I I can't believe everything that you're doing. I mean, I'm so inspired in the film. So you're currently a scientist at Alnylam? Alnylam Pharmaceutical Company, which is working to develop medicines for a variety of rare diseases. So thank you for being here. Patrick James Lynch is the filmmaker, media professional, and globally recognized health advocate who has delivered more than 100 presentations around the world. I ran into him out there when I was going to the bathroom. I said, how'd you film that? So maybe he'll enlighten us with some of that information. He's been recognized with numerous awards, including the Hemophilia Federation of America's Health and Wellness Award, the National Hemophilia Foundation's Meritorious Service Award, and he's an executive producer of Save One Life's 2020 content campaigns. Also has a 501c3 entertainment company called To Effect Change since 2013, and has been the CEO of Believe Limited. Dylan from the Every Life Foundation, who serves as our Director of Policy, and has been focusing on newborn screening and diagnostic policy issues, and he works really hard for the foundation. His leadership with our community included the passage of landmark state legislation providing expedient implementation of RUSP conditions. Thank you. And Connie Montgomery, who I think everyone seems to know. She's a occupational therapist who's currently serving as the family faculty member for the Medical University of South Carolina, and a patient and family advisor for the PFCC Partners in Long Beach, California. You also have factor VII deficiency, a rare bleeding disorder, and an autoimmune disorder. Alongside with, you also have insulin-dependent diabetes. You're an internationally recognized motivational speaker, and thank you for being here. Okay, I get the privilege of starting the questions. There's so many things I wanted to ask you, Chris. The story is just incredible, all the phases and lessons in perseverance that you exhibited, and the disappointments that you experienced as a young person, and just so admirable how you turned that energy into pushing yourself so hard physically and mentally. How do you view your journey and the role of the others? I was particularly struck by the Sherpa. And the spirituality of the people at that base camp. So what advice do you have for other people going through journeys that are difficult and challenging? And what roles did these people play for you? Oh, yeah.
Yeah, it's always fun to watch the film and like get to remember that amazing journey. It's really interesting thinking back to when I was a child with hemophilia and how much I resented having that condition and feeling different and feeling not as good as other people because I had a medical condition. And that was a huge aspect of my childhood and you know, really shaped in a way who I became. And it wasn't until after college and meeting this amazing bleeding disorder community that I realized like having this medical condition didn't mean that I was less than anybody else. It meant I already overcame a lot just to kind of be where I was in that place in my life. And so, you know, I realized that having hemophilia actually made me incredibly resilient. It made me, I think, very compassionate and empathetic. And I think those were a lot of skills that translated really well. It also made me incredibly stubborn. So I think those are all things that like really translated well into being on the mountains and climbing. And I think coupling that with the finding a community to like connect with, you know, trying to bridge the gap in the disparity in care around the world also like fueled it even more of like realizing there's so many other people with the same condition that are struggling. And so that like all came together really to kind of provide this crazy amount of motivation to do this. And even in those hard days of training or hard days on the mountain, it was a way to like remember to keep pushing forward. And then, you know, you don't do any of these things without amazing people to support you. So I had my doctors in my treatment center, my parents, my wonderful, amazing wife, who I don't know how you dealt with this for so many years, but thank you. And, you know, obviously the climbers and the Sherpas that I climbed with, you know, Ryan, as a guide, could have easily said, I don't want to deal with this condition on the mountain. And he never thought that way. He learned and wanted to figure out how to work with it. And then Tashi, you know, Tashi is just one of the most incredible human beings ever. I think he's like 30 years old now and has summited Everest like 8 times. And that guy was literally like running around at the top. I was just like, dude, I don't understand. So, you know, I think, you know, just being able to have these experiences and meet so many amazing people and realize there's so many positive things to uplift each other, that's been really, really special. And now I get to meet another amazing community with the Every Life Foundation, and it's really inspiring to see so many community advocates here that are going to the, you know, Capitol Hill to try and make a difference. And I think that's just, it's inspiring to see that and continue efforts to make a difference in people's lives. So, yeah.
Thank you.
Absolutely.
All right, so Jessica, how did it feel at base camp? Like, I can't imagine. I would have been like, I don't know what I would have done.
Well, the trek to base camp was actually really wonderful and gorgeous, and just coming across all of the people, the locals that lived there, the bridges I think you got to see in the movie, and I don't know, it was incredible. It was really awe-inspiring, and then I think being at base camp was. I don't know, it was kind of surreal. I was sick the whole time that we were there, so it was a little bit of a blur, but also getting to experience watching all the different climbers prep for their acclimation hikes, and getting to watch Chris specifically prep for his climbs, and kind of watching his nerves come over him and the anticipation. It was really incredible. I'm glad I was there. I'm glad I didn't have to stay there. I was only there for, was it 3 nights, I think? And you were there for like 700 days?
Yes.
Yeah.
Well, I don't know how you left. It must have been really difficult.
I did, yeah. So I stayed for 3 nights, and then I left and went back home. Because not everyone gets, you know, that much time off from work.
Patrick, you're also a hemophilia patient,
I am.
and I'm wondering how did that inspire like the creative direction of the film, and how you thought about making the film?
Yeah, one of the things I love about documentary filmmaking is that, you know, if you gave 100 different directors a script for a scripted narrative film, they'll each have their own take on it, but it will be similar-ish, one to the next. But if you give 100 different documentarians a story to go cover and say, make a documentary, you're gonna get 100 very different films. For me, I connected with Chris and his story very intimately. We're the same age. We have a lot of similar interests. We had both been doing advocacy work on national and global levels at the time that we met. And I was compelled by his idea to capture this in as meaningful ways we could, not only because it's a moment in history that matters for our community and a chance in capturing it to maybe expand awareness of our community, but it was also an opportunity to point out the disparity that Nepal is one of the poorest nations in the world. As Chris points out, none of the people in Nepal will be climbing Mount Everest with hemophilia anytime soon. And he wanted to shine a light on that incredible disparity. And I thought that was compelling. That level of drama, that level of conflict is just inherently interesting. And we've adopted this term, at least within rare bleeding disorders, of lived experience experts. So there are medical experts, there are scientific experts, there are clinical experts, and there are lived experience experts who know about the day in, day out burden of having hemophilia, either yourself or your loved one. Only lived experience experts really know what that's all about. And it was really, right? And so I knew the amount of pressure that Chris was feeling. I could feel it too. And I knew all the community that were paying attention. And I mean, blowing up social media, tracking his journey. I also knew the legacy of our community and that terrible little 2-minute side road we go down to teach you a bit about the contaminated factor products that led to 90% of people with hemophilia contracting HIV or hepatitis C. And there were some who said that shouldn't be in this movie. That's a different story.
Oh, I thought it was really
I agree with you completely. This is my press agent right here in the front. Although I will say, not to spend too much time on this detail, but at the time that we were screening it, you know, as you get closer to a finished product, you start doing screenings for folks you trust, both people who are within filmmaking and talk the lingo, but also people who are not and who can just respond like a normal person. And in a near final cut of this, that sequence was a bit longer. And I remember very well how split people were about that is so important, you gotta take that out. I knew it was never coming out. But there was a note. There was something that wasn't quite working, and that was what people were responding to who said, you got to take it out. So we shortened it. We changed some things structurally. No one's ever said anything about it since, except that they're so thankful that that piece is included. So I think that's an example of being a lived experience expert so that I can stand in front of a room, and even if many voices are saying to me, that can't be in there, that shouldn't be in there, hear it graciously. That's part of the job. But then confidently go back, talk to my people, and make a full decision based on what we know is most important. And I had the confidence to do that all along the way because I am a lived experience expert.
Thank you very much for that. Connie, I know you're also a person with a lived experience. What does your experience as a patient look like, and how are you using that to empower others?
Well, first of all, I want to thank you for that question, but I also want to thank Every Life Foundation for this opportunity to be here tonight, and each and every one of you who are sitting here listening to the sound of our voices. I've been a member of the bleeding disorders community for quite some time. I didn't find out I was diagnosed with factor VII deficiency until after a car accident. It was a blessing. A car accident was a blessing because it had been 3 decades when I had shared my symptomology with folk and told them of different things that was happening within my body, but I never got a proper diagnosis, and some healthcare practitioners never even listened to me, even after I became a healthcare practitioner. They would say to me, you're exaggerating about the condition, it can't be that bad. And some others would say, you know, women don't have bleeding disorders. Women bleed, but they don't have bleeding disorders. So I went through that, and after going through all of that and finally getting a proper diagnosis and meeting so many wonderful people like Chris Bombardier, his wife, Jess, and Patrick Lynch, and yes, I will say Val Bias, who used to be a former president, you know, God bless him, he's passed away now, of the National Hemophilia Foundation, which is now the National Bleeding Disorders Foundation here in America. I am so grateful for the community. I am so grateful for the blessing of a rare disorder. Do you know why? Because it gives me the opportunity to be in the room with you right now, sharing my journey. Yeah, it took 3 decades to get a diagnosis, but you know what? It was worth all of that for me to have this moment with you all right now and say, yeah, we have some struggles when we have rare diseases. We have struggles with the diagnostic odyssey or journey of getting properly diagnosed, correct? Mm-hmm. We have struggles with people looking at us saying, you look absolutely fine. I don't see where there could be any problems, correct? Yet we get up every day and do what we need to do, correct? So I'm very happy to be here tonight. I wish that the journey for many coming in legacy won't be the same as it has been for myself and those before Patrick, myself, or Chris. I pray that they won't have to experience the things that the folk that came before us, like Ryan White, like Val Bias, experienced. I hope their journey is easier because of the things that Chris Bombardier did with conquering Mount Everest. So my journey's been difficult, yes. But you know what? It's my purpose, my passion, and my work now to make a difference in the rare disease community because of it. So you can take your adverse situations and turn them into a positive, not just for yourself, but also for others. Thank y'all so much.
Thank you, Connie. Well, Dylan, that's a great segue into, some of the things that Every Life is doing and why we're here. So maybe you could spend a few minutes talking about the Accelerating Kids Access to Care Act and what we're trying to accomplish there. Given all the studies we've done on the burden of rare disease, the diagnostic odyssey, which Connie just so eloquently explained, and which we've obtained hard data for, 6 years, 17 medical providers, 2 out-of-state trips on average to get a diagnosis. This is not working. So can you share with us a little bit about the work we're here to talk about at Every Life Foundation Rare Disease Week?
Yeah, happy to jump in here. And you made a great point in terms of the fact that so many need to travel out of state to receive their medical care, and that receiving medical needs often will take you outside of your state borders, but Medicaid doesn't travel quite so easy at times. And so the Advancing Kids Access to Care Act really looks at increasing that efficiency of enrollment within Medicaid programs so that when you're going out of state to receive that treatment that you need, because we know, as Vicki said, of those 17 healthcare visits along the way to receive your diagnosis, at least 2.5 of them are going out of state. And so we know that members of the rare community are traveling across state lines to receive their care, but we also know that that process could be easier, could be more efficient. And because we know that the faster you can get care within the rare community, the better. That every day, every week, every month, every year is lost time. And so how can you find ways to make that process more efficient? And the Accelerating Kids Access to Care Program Act does that. And what it does is it helps to make it more efficient in enrolling within the Medicaid program across state lines to ensure the fact that as kids are traveling to receive their diagnosis, to receive treatment, that is easier to get the care you need from physicians in different states. And so we'll talk much more about this tomorrow. We have a whole deep dive on it, so happy to answer more questions there, as well as tonight. But we're going to do a full hour-long session on this bill tomorrow.
Thank you. So I have one more question for Chris, and then we're going to open it to the audience for a few questions. You know, one of the things that really struck me in the film was this issue of insurance and access to care, and sort of the parallel between the complete inequity and lack of access to care in the developing world, but the challenges that still exist here. So could you talk a little bit about the work that you're doing now to address the inequity there and here?
Yeah, so I have to say my own personal journey, it's been interesting. When I was young, I didn't know anything about insurance. My parents just did it, which I'm very thankful for. But it wasn't until I was older that I realized like the sacrifices that my parents had to make. This is all pre-Affordable Care Act of my dad staying in jobs that maybe he didn't necessarily love or could have had advancement somewhere else, but it had to maintain the same insurance for me and my medical condition. So I never understood like the burden that had on a family growing up. And then I went to college and graduated college. And this is also pre-Affordable Care Act, and that's when you didn't get that kind of grace period till you're 20, is it 25 or 26? 26. So it was, I graduated and they're like, you have 6 months to find essentially insurance from somewhere else. And that was like a really huge wake-up call. I'd have friends that were, traveling or, just trying out different jobs, but they didn't have anything to worry about. And I just remember thinking like, oh man, like this is disappointing and tough, because I wasn't sure what I wanted to do out of college. And luckily I got a good job, and it wasn't my favorite job. I was working in a lab, and it was interesting, and I enjoyed parts of it, but I knew it wasn't the right thing.
Some good things.
Well, I did meet her. I met her, so that was the best part. But, man, that could have ended up badly. But no, even when Jess and I met, she realized I wasn't happy, but also pre-Affordable Care Act, like, where was I going to go? I had to find specific jobs. It was just so limiting. And then when that was passed, it really was really transformational for me, and it opened up so many more possibilities of what I could do with my life. And that was so amazingly, important for rare disease communities. But obviously, that still was in jeopardy just a few years ago, and it will always continually, be something that we have to fight for to continue to have. Because, getting to visit a lot of these developing countries that I've gone to, I was just in Pakistan a few weeks ago. They have to fight all the time to get even the basic access to care, and even then, they're still not getting it. And it's just a very big realization that access to care is not guaranteed, and it's our voices that ensure that continues to happen. And so, going to these countries and traveling, that's something that we always talk with them about, is like, it's a long journey and you have to be resilient, but luckily we've already learned how to be resilient with our medical conditions. So it's kind of just putting that effort into their respective situations. So
Thank you.
yeah.
Do we have any questions? Someone must have a question.
More of a comment. Thank you for highlighting the importance that it is for you to travel with your medication and with the equipment that you need.
Yeah.
Because I think a lot of times, just society don't realize how hard it is to travel to go to other countries with medications that they might not even have there. So you have to make sure that you have enough of what you need, and also the diligence of making sure that your provider here is making sure that you're going to have all the medication when you need your job.
Yeah.
I have a very complex child, and taking him out of the country is very challenging.
Yeah.
Flying with oxygen is very complex. So just you highlighting how you have to prepare and bring these things that you need.
Yeah, no, thank you for mentioning that. And we didn't really talk about that. That could have been like a whole section of the movie at some point. But even getting enough medication to be out of the country for 3 months was something that we had to start working on months and months ahead of time with my treatment center and the insurance company, and like having to like really advocate to like get enough product to be gone for that long. Like that was not an easy discussion and took a lot of time. So it can be done, but it just adds another layer of complexity to traveling internationally, which is not always easy. So.
Yeah.
Hi, I actually just have a comment. I don't know if I can get through it, but I just want to say thank you for including the section on the patients that contracted HIV. That was my brother. So thank you for including that.
You're welcome.
Yeah, absolutely.
Hi, two quick questions. The first one, is this movie available to share? I'd love for my son to see it. And then next, Chris, what's your mom have to say these days, or did she just give up on you?
I can do the movie part. You talk about your mom. Yeah. The short answer is yes. BombardierBlood.com has links to the various places, but it's available for rent or purchase on Amazon, on iTunes, on YouTube, Vimeo, so numerous places. But BombardierBlood.com is an easy one to just go there and click the links. And I'll let Chris talk about his family.
My mom is just happy that I'm done and asks that I never do anything like that again, but not a very good listener. So I'm going to go climb Mount Blanc next summer, actually, or this summer. It's this year, with 9 people with hemophilia from all over Europe, which is going to be really exciting. But she is doing well. We have a son now, so she has a grandchild. So now she's very, very happy. So.
Yeah, this being a rare disease community, we're always curious about some disorders and such. And Patrick, the question is to you. Did you get that boot from Nepal or Antarctica?
I got this boot from being a teenager with a lot of bleeding episodes, but I'll take the question as the opportunity to talk about what a team sport filmmaking is under all circumstances, but these were particular circumstances. So I was in Kathmandu with Jess and Chris, but actually by the time they left for Lukla and started that 8-day trek to base camp, there was only one member of my team there who was the mountain director, the mountain cinematographer, the mountain sound operator, the mountain producer, the mountain everything. He's the one you see with the phone holding it up to try to facilitate the conversation. So without Rob Bradford, this film could not exist. Filmmaking is a team sport, just like Rare Disease Coalition. So to steal from Tashi, right, we always do better if we work together as a fist, not a finger, but a fist.
Up here.
It's just a quick question, talking about traveling. Talking about traveling, because we had an episode in Dominican Republic last fall, and believe me, it's a mess.
Yeah.
Lovely people, but anyway. Do you have difficulty finding ways to keep your medication cold enough?
Well, it was actually, sorry, I gotta move this over. For most of the climbs, it was actually the opposite, keeping it frozen, or not from freezing. But yeah, so the particular medicine I'm on now is stable at room temperature, which is a huge difference. But it's funny, when I was traveling for most of the climbs, yeah, it obviously wasn't a concern. But when I was younger, yeah, I'd always have to have, ice packs and coolers and try and keep it cool. And it's just it's another headache of trying to get it through. And then traveling with ice packs and going through security is always just a joy, right? I've gotten some real interesting questions in some of the airports I've gone to, in Nepal or Pakistan, of like, what's this? It's, a lyophilized protein powder, so it's a white powder. They're like, what's this white powder in these vials? And I'm like, I promise, it's just medicine. But, get some good looks, which is always interesting. But yeah, so like I said, I haven't had to think about it as much lately. But yeah, for me, it was mostly keeping it from freezing, which was a whole different adventure. But yeah.
Cold until you got there.
Yeah.
I think we have time for one more. Well, we'll do two. Okay, here we have two right here. I gotcha.
Oh, 3, yeah.
Oh, I didn't see that.
Hello, thank you very much for the movie. Was incredible. I've got hemophilia B myself, 48 years old, severe. Nice. I've had 2 knee replacements and broke my femur.
Oh my gosh.
And just thinking about, what you've done there, and talking about, packing enough factor. Like, I'm here for 3 days. I brought 3 doses with me and infused yesterday.
Yeah.
So how do you account for all that? And did you have any breakthrough bleeds, like the entire time?
Yeah, so that's a great question. I didn't have any breakthrough bleeds, which is was great. I was doing, my pretty much regular prophylaxis. Though on the mountain, I did do a dose before I went. Whenever I went up on the mountain, I would do a dose, just because there's some really, sections where things can fall on you. But yeah, when I was trying to create a plan for the whole trip, I worked with my treatment center, and we calculated out, this is how many doses you'll need if everything goes perfectly. And then we tried to calculate how many on top of that in case something goes wrong. Okay. And obviously, luckily, nothing went wrong, so we didn't have to use any of that. But I did have, I was there for 3 months, so I had actually 4 months worth of factor. So I had a whole extra month just in case things went real sideways. Because, obviously getting off the mountain and then getting back to good care could take some time. Right. But yeah, that was part of the calculation. It was just, we sat in the room for a few times and try to figure out what the best plan was going forward and how much to bring, and then how to talk to the insurance company about getting it without mentioning a mountain, so it worked well.
Thank you.
Nice to meet another hemophilia B person.
Okay, so how hard was it to tell your friends in middle school about your condition?
Oh.
How much time do we have?
Yeah, we could talk about this. So it's funny. I didn't want to talk about it And then my mom convinced me in elementary school to do like a presentation for a class. And we talked about it. And then everybody kind of felt like it treated me different. And then I hated that we did that. So then I kind of went on the other path and just didn't tell people at all unless I felt like I had to. So I told baseball teammates in high school and college, but then really tried to downplay it and like, it's no big deal, it's no big deal. Because I just didn't want to feel different, you know? And, you know, it's funny thinking back on it, and now, you know, as I'm older, I'm like, I'm glad I'm not the same as everybody else. Like, that's what makes me special and unique and important. And, you know, I wish I would have had that thinking back then, but when you're young, like, you just want to fit in, you want to be like everybody else. So it was incredibly tough, you know, to have that conversation. And, you know, I think I wish I would have told some of my closer friends and been more honest about what I had, because I think they would have been very accepting of it and you know, supportive. But I didn't have that wherewithal, unfortunately, when I was younger. So.
And I'll just add a little, because my experience was a little bit different. There you are. I had a lot of bleeding episodes when I was a young person. So I was on crutches, I was in a wheelchair, I had a sling. And with hemophilia, like, sometimes the bleeding can surge, and then a day later, you know, you've got it resolved. So I'd be on crutches, and then a day or two later, I'm like walking around, and people are like, what's going on?
Yeah.
Did you just not want to do gym? And I was like, no, I definitely wanted to do gym. I don't want to do this.
Yeah.
But
Did they call you like a faker and stuff?
absolutely,
Too?
yeah.
Got that too.
Faker, all
Yeah.
this stuff. You just want to miss school. You just don't want to do school. And I just wanted to fit in and be normal. Like you said, I wish I had a little more comfort, but also I didn't trust my body, and I didn't know. And it's a hard period of time to begin with. So, you know, I don't have any pearls of wisdom to offer you, to be quite frank. I think it's just worth acknowledging, like, it's hard sometimes. It's hard sometimes, and, you know, telling somebody, is that a good idea? Should I not tell them? Like, this stuff isn't black and white. I will agree with you, though. I wish I had even one person, either with hemophilia or like a camp friend who got it well enough so that I could just like call them up at times and be like, this sucks. Like, this is terrible. Do you go through this? Because this is terrible. And I didn't have that. So that's one thing that I would recommend, is like, try to find that one person.
Yeah.
Well, for me, the experience was totally different. My mother was something called Gullah Geechee. So I was raised Southern, grew up in South Carolina, and what happens in the home, can someone finish that statement? That's all.
Well, I want to again express thanks. Thank you all so much for joining us here and starting off our Rare Disease Week with such a special film and such a special group of people. Thank you so much.
Thanks for having us.